So clearly he wants some feedback on his change. Oh yes, that's looking good. Clearly it's not a clean profile, so that the second photograph is taken roughly from the same angle at the same head tilt. This area here you can achieve over the age of 25, almost at any age. How can I adjust to chewing more without jaw pain, TMD, after 2 years of barely anything? Hello everyone, I'm Dr. Mike Mew. Today we're diving into something a little different. I will be exploring and reviewing the Orthotropics subreddit, a community dedicated to discussing and sharing everything about orthotropics, including mewing. It's incredible to see the engagement and discussion from so many of you on this topic. Let's take a look at some of your posts and see the insights, progress and questions that you all have about orthotropics and mewing. So we could start with this mewing 1 year progress. We've got a photograph. Let's see the photograph. Interesting. I am 16 turning 17 and I started mewing around the beginning of last year. I think I've shown a lot of growth because puberty is really affecting my face. So also applying the tongue on the palate and keeping my teeth closed, I was able to achieve this in just over a year. So clearly he wants some feedback on his change. Oh yes, that's looking good. Clearly it's not a clean profile. His head's tipped down, but I think he's got a fairly good comparative photograph. So that the second photograph is taken roughly from the same angle at the same head tilt, and I can see the development on the angle of the mandible. That is quite clear and obvious how this area here has developed up. Now that you can do at almost any age. I think that is one of the changes that you can achieve very much later with mewing. So this area here you can achieve over the age of 25, almost at any age, because that's just the application of muscle forces. You can tell if a skull is male or female by the fact that you feel brow ridges on men. Now you feel brow ridges on men because we do a lot of work with our eyebrows for some reason. So because we work with our eyebrows, that builds the bone, the insertion bone up, and you can do that at any age. And you're just building up the insertion where the muscle inserts into the bone. You can develop that at almost any age, or lose that at almost any age. What he's achieved here that is really impressive, it's the change in the chin area. The change in the chin area, it's really impressive. Unfortunately, he's got that lock of hair just hanging over where I'd really want. Yeah, that's just messing up my analysation of his mid-face. Shame, show another photograph without that lock of hair and I'd have a better job of that. But this area here, as even Bjork showed us, is one of the hardest areas to analyse. That's really hard. I need to see someone really in 3 dimensions to understand that. This gentleman has made a clear and obvious change in his chin position. Now, the two of these combined, the chin position here, because the whole of the mandible seems to have swung a little bit, moving that chin point forwards. Now, the combination of the building up of the angle area and the chin point, that looks really quite dramatic. I'm really quite impressed with the gentleman. He's clearly worked hard. He's clearly young. He's worked hard. Well done. Keep up the good work. If you're not mewing, what you're doing. So moving down. Okay, so we have a question here. Question about mewing. Hello, I'm a 15-year-old male with a recessed jaw and maxilla thanks to years of mouth breathing. I've been mewing for the past 1.5 months, so not very long, and it seems to have 0 differences in my face so far, despite very dedicated with always breathing from my nose, keeping proper neck posture, etc. Well, I question that from my experience. People overrate what they've done to change, and also 1.5 months is nothing. Come on, this is a lifestyle choice. This should go on for years. Recently, I've been experimenting with different tongue postures. When I came upon 2, I feel suction with this tongue pressure rather than 1 where I'm purely using my tongue muscles to keep it up. So he's referring to the 2 images here. However, when I swallow, my tongue naturally goes into position 1. The photo above is a cross-section of my mouth. The grey is the teeth, light pink is the tissue around the mouth, and the dark pink is the tongue. So he's saying that if he moves his tongue further forwards and further down, he can get better suction than if he has the tip of his tongue back. Now, this is a long-held debate about where the tip of the tongue should be. And should the tip of the tongue be forward so it touches the back of the front teeth, the back of the incisors, or should the tip of the tongue be set back slightly? Well, in reality, what's the answer? So ideally, we want the tongue on the end spot, just behind the upper incisors. However, remember that this is an average, and it's an average for a modern norm. And modern norms aren't architecturally the same as our ancestors. We're all somewhat compromised, and the end spot is the best compromise we've come up with. That said, because we're in a compromised situation, the best position is the position where you can get a good suction hold. And where exactly the tongue sits on the back of the upper front teeth, it should be back away from the teeth, but if you go on to the teeth and you can get a suction hold, that for you will be the best position. Fantastic. If that's the best place for you to get a suction hold, that's where you should place your tongue. You're 15 years old now. The next 5 years will be crucial. I know that seems like a long period of time for you. Don't forget, if you wanted to build your body, if you wanted to get a great physical form, it would take minimum of 5 years to get that types of changes. And this is a lifestyle choice. If you're not mewing, what you're doing. Keep up the good work. Okay, so now we have a comment. Ortho wants me to use a retainer and my parents agree. I am pretty much done with my braces and the ortho says I'm going to need to wear a retainer or my teeth will become crooked again, which is actually a retainer for the rest of his life. I've been practicing mewing for a couple of months and want to tell my parents about Mike John Mew and their work without seeming like I'm just being delusional, seeing random crap online. How can I show my parents what mewing orthotropics is easily? How can I adjust to chewing more without jaw pain TMD after 2 years of barely anything? Something ortho telling me only to eat soft foods. Well, I have a big issue with that whole concept of asking kids only to eat soft foods. You can understand why. I can't give you definitive advice because if I give you definitive advice on what to do, I'm taking on responsibility. So all I can do is say what some people have done. Now, there are lots of different types of retainers, and you could get a retainer that doesn't cover the teeth, just like a Hawley retainer, fits up on the roof of the mouth and prevents the teeth from dropping back, so it's the minimum volume. And you could try maybe just having retainers fixed to the back of the front teeth, because those are the type of lowest volume retainers. They're going to have the less influence. Work your way down. Maybe if you've had some widening, it could be a good idea to maintain that width with a retainer that clicks into the roof of your mouth. Okay, I'm not giving you advice on these. This is just ideas. The retainers that take the least volume and also allow the most dynamic change would be retainers bonded just to the back of the front teeth, because they're going to allow, there's a very thin wire, the wire could flex open and flex close, allowing you to make gains and clearly tending to minimize the amount of relapse that you're going to get. One of my worries is that the teeth, the bone around the teeth and the gums sit in a balance between the tongue and the lips. And if you need to wear a retainer, then the teeth aren't in their balance zone, they're moving out the balance zone. You can hold the teeth out the balance zone with a retainer. You can't hold the gum and the surrounding bone out the balance zone. They will go to where they want to go. They don't care what your retainer more or less is going to dictate the teeth position. So my suggestion usually, and this isn't your advice, you've got to discuss this with your parents and your orthodontist, is consider the fixed retainer behind the teeth, because this seems to impede the dynamics of change far less than other things. But again, this is a difficult dilemma. I understand where you are. I don't like this concept of retainers forever. If you've had orthodontic treatment, then clearly there was a problem, and it's not easy to get out of these problems. That requires dedication and hard work. So keep going, keep your mewing journey, but you need to be compromises. You need to be sensible, because maybe you're not going to mew forever. Maybe you're not going to mew effectively, and then you could get relapse, and then where are you going to be? All right. Thank you for joining me on this insightful journey through the Orthotropics subreddit. It's been enlightening to observe your discussions, progress photos, and sense of community you've fostered. Remember, orthotropics, and especially mewing, are about more than just aesthetics. They're commitments to improving oral and overall health. Continue to explore, share, and support one another. For more detailed guidance on orthotropics and mewing, be sure to check out our YouTube guide and the Mewing app. Until next time, Keep up the excellent work and stay curious about your health and well-being.